Hello, viewers. My name is Alho Gilbert, and I'm from Retisight AI, and I'm the team lead. Through this video, I'll explain to you what Retisight AI is. At Retisight, we are saving sight through accessible AI screening and affordable phone-based fundus imaging. Why and how? So, uh, research was carried out in Uganda, particularly northern Uganda, that in 5 years, uh, a patient is able to have diabetic retinopathy screening at least once, which calls for a gap, and this is leading to preventable blindness globally. Yet more cases are called too late. So this tells you that no screening access. There is no screening access, and the cost is high. A case in point is that the equipments that are used in eye care units are very expensive. One fundus camera costs around 300 million Uganda shillings, and there is shortage of specialists for example, here in Uganda, Kabale, particularly district, is that out of 5 hospitals, only 2 hospitals have diabetic retinopathy ophthalmologists. So this tells you the case. What about other countries? So this leads to late diagnosis with late early detection, causing vision loss, so which is irreversible. So many patients lose vision not because treatment doesn't exist, but because the screening happens too late. So what are we bringing on board? Retisight AI brings AI screening anywhere. Retisight combines what we call a portable phone-based fundus camera with AI-powered screening software, transforming diabetic retinopathy screening from a special service into a scalable primary care. Retisight AI here, we are developing a phone-based fundus camera, which you can see on the left, and we have our optimized platform that has AI that will give insights in real time and prediction whether this patient should be referred. And how it works is that the health worker captures the retina using the phone based attachment that we have developed, analyze, and then this image is uploaded into the application. The AI screens diabetic retinopathy in seconds, instantly, without delay, and they are able to refer patients with high risks, and they are sent to for specialists referral. So, what is our competitive advantage? So, who are the people we are serving? Millions of diabetic patients across Africa require regular retinal screening. Most have no access today. And this tells you that there is truly need. But at the end of it all, with our portable phone-based fundus camera that will beat the 300 million best fundus camera that is currently bought, is that for us we shall be able to sell our equipment at a lower price. That tells you that we have a huge market. And then this tells you that we are bringing this into, since we are bringing this into any places, this tells you that there will be primary care and community health centers to give these services. So we shall be able to work with government and NGO programs for public health initiatives targeting diabetic populations. So, how do we plan to get money in this Retisight AI into our system? Is that remember, we have a portable phone-based fundus camera instead of the other huge machine that is put into clinical centers. For us, we have a phone-based fundus camera, so we shall be able to sell that device. And then we have AI software subscriptions for people who want to use AI. That is the providers, they want to send images to our platform, they have to subscribe. So we shall also generate money while working with the government. And also here we plan onto our software, we plan to have remote specialist referral networks, as in a patient himself can also buy the device and have an online meeting with a doctor without the need of going to the hospital, which is the current state of medicine where we're heading to. So we are building this literally for low resource healthcare systems. I left on my left, this is the traditional system. This is the bigger component that are existing in the health sector, and this is what we are bringing on board: just a phone and a phone attachment, which is a Fundus camera, and then AI online. So you can look at this is a market opportunity. So our differentiator here is that Retisight removes the barrier that prevents screening at point of care. Cost, complexity, location, and specialist dependency. Remember that this equipment on the left, it costs around 300 Ugandan shillings, and for us, we are bringing for you an equipment that will cost of around 1 million. So this tells you that there will be reduced cost in the service, and then complexity, there will not be a lot of complexity unless if it is, remember this is a diagnostic tool, remember, unless it is complicated, so you'll be referred to a specialist. So that's it. Where are we right now is that we are currently working with the School of Medicine at Kampala University in Uganda, and this tells you that the model we are building to be able to carry out AI screening is that it is being built with while being validated. So we currently have a functional MVP, and also we have a core hardware architecture. We are working on this to ensure that we refine it more better. And then we have clinical partnership, and on our team particularly we have a doctor who is a medical practitioner from Tanzania, and so that tells you that AI validation is in progress. We don't have to wait to reach in the market and validate. We are validating right now, and yeah, so with the software we are almost we are done. We only need to adjust a little things, and then with the camera is what we are still working on. So we are soon going to have a prototype. So so from local pilots to regional scale is that this is our market strategy, and we plan to test this in Uganda, deploy in hospitals and clinics, validate the AI accuracy and workflow integration, and then partner with clinics to ensure that we partner with clinics to ensure that we build a robust system, and then scale across the region via health distributors and government channels. So this is our team, and on our team, like I said, we have a medical doctor from Tanzania, and the team lead, I myself, am the air engineer, and the rest of the team. So you can look at our team. We are composed of people who have different expertise. So help us prevent for the preventable blindness in the world. Early diagnosis is just a chance to save someone's vision. We are seeking partners. We believe that access to eye care shouldn't depend on geography or income. Particularly, I can tell you a case of point. My grandfather at home is blind because of diabetic retinopathy. He doesn't know that it is the reason as why he's blind. He just thinks that something fell into his eye. So, early diagnosis is a chance to save someone's vision. Thank you very much. This is Retisight AI.